Hey, what's up, everybody? I just finished a great episode with Beth Machnica. She's the Director of Health and Wellbeing at Buffalo Niagara Medical Campus. Really fascinating conversation about health and nutrition. We talked about what BNMC actually does, but more so we talked about the issues with food, with nutrition, but right here in Western New York and then more globally, and how we can kind of solve them to promote healthier lifestyles. Beth is amazing, very intelligent. Really enjoyed talking to her. I mean, honestly, we could have talked for a lot longer. We might have to bring her back to address some of the issues we got into. But if you want to know about how to live a healthier lifestyle, things to avoid, her thoughts on GLP-1s, check out this episode. I think you're really going to enjoy it. As always, this episode is brought to you by my law firm, Richmond Bona Personal Injury Attorneys. Hope you never need us, but if you do, we got your back. Look, if you like this or like episodes like this, please like, subscribe, follow us on social media, wherever you get your podcast. Helps us keep guests coming in. Enjoy the episode. What's up, Beth? Thanks for being here.
Hey, thanks for having me.
We're excited to talk. So we're getting to know ourselves a little bit before we started, but I figure usually I like to start off with being like, okay, like tell us who you are, explain your role, and then we're going to jump right into some stuff because there's a lot of ground to cover.
Sure. Just start from the beginning?
Yeah, just to tell. I want to hear your journey. Like, how did you become the Director of Health and Wellbeing for Buffalo Niagara Medical Campus?
Okay, yeah. Born and raised in Buffalo. I grew up in Cheektowaga and pretty much grew up on the pizza and wings that most of us Buffalo natives grew up eating.
Yep.
And then from the time I was 16, I knew that I wanted to study nutrition. And the main person and mentor that had the most influence on me was a high school teacher. Her name is Mrs. Nutrino. Shout out to you if you're still around. And I took an elective called Health, Nutrition, and Fitness. And we had to do an assessment of what we were eating. And I found out that I was taking in a lot of calories with not much nutrition, like putting snack packs, rice-a-roni, Hamburger Helper up the gazoo, not a vegetable in sight. And as a nerd, a straight A student, like that really bothered me. I wanted the A. And so I started trying to eat healthy, and it was like terrible. Like I hated the salad, I hated the healthy food, didn't taste good. So at 16, I started a cooking blog, and I started investigating how can I cook food myself to make it taste good. And there's a little bit more that's into the story as well, but we can talk about that later with my own PCOS and health journey. But basically, yeah, I knew from a young age I wanted to be a registered dietitian. I went to school for that at SUNY Oneonta in the Catskill Mountains. And then from there, I got matched at UB for my dietetic internship and worked in the local hospitals here at Roswell Park, the VA, Kaleida Health, Children's Hospital, and really felt a sense of moral injury working in the hospital. It's nothing against the local hospitals, but I felt like I wasn't really making a meaningful impact on health. And so went back to school for my master's in public health and really wanted to tackle it from the systems level. And at the time, I started doing research at the University of Buffalo Food Systems Planning and Healthy Communities Lab. And that's where I really immersed myself in the research and how we can actually move the needle on public health, and saw the job opening at BNMC. And really, I've never seen anything like that before, where you have this umbrella institution, nonprofit that's bringing together the region's largest employers, local government, healthcare institutions, community-based organizations, local neighborhoods. And I felt like I could really make change in that type of a role because essentially BNMC was built to make systems change. So I turned down 2 full-time hospital RD jobs to take a part-time role, which to me, I perceived it to be more meaningful work, and I've been there for 10 years.
Wow. You know, I think a lot of people in Buffalo don't understand, or maybe it was just me prior to like researching this, that BNMC is like actually an organization in and of itself. It's not like that's the medical campus. Like it's actually like an organization, a not-for-profit. Yes. Can you talk a little bit more about, you know, BNMC's mission, like what you guys do and in the community?
People see the walls, and that's what they perceive.
Yeah.
But in addition to being a 120-acre campus, we're also a nonprofit. And ultimately, our mission is to make systems-level social change and transformation. And what you don't see is all of the sort of the invisible, intangible infrastructure that are the people power of the campus, and that's where really the innovation happens. So our organization has been around for over 20 years. We focus on systems level changes, particularly in business innovation, transportation, and health and well-being, and I oversee the health and well-being side. So how are we forming the connective tissue of the campus and making not only the employees, but also the patients, visitors, and surrounding communities healthier? What's
your day-to-day like in your current role? Like, what are you tackling on each day? And like, maybe what's like the biggest problem or issue you're battling today?
The day-to-day is so wide and ranging.
That's good though, right?
I'm here talking to you on a podcast, which is pretty cool. The World Cup was just going on, so we have a pocket park outside with Wi-Fi. So we sit outside in our computers and have the World Cup on. Or I might be meeting with a farmer from a local community. I might be meeting with a doctor and a clinician up at the Jacobs Institute talking about like health and well-being. Every day is different, but the biggest problem that I'm trying to solve, my big, hairy, audacious goal, is to make the city of Buffalo a blue zone. And there's a lot of work that goes into that, but essentially it's reconnecting our healthcare system and our food system.
I love that you know what bags are. Not a lot of people know what big audacious hairy goals are. That's awesome. So what's a blue zone? Talk us about that, and like how do you become a blue zone? Because it sounds like it's probably pretty hard.
Yeah. So there's only, I believe, 5 or 6 blue zones in the entire world.
Wow.
And it's where the most centenarians live. So centenarians meaning people that are over 100 years old, and they die of something very unique, which is old age. Wow. So 0 prescription medications, they're active, they naturally eat more plants, they don't drink a lot of alcohol, they're not bodybuilding or running marathons, they're just naturally healthy because their environments make them healthy. Mm-hmm. And so in the United States, about 90% of us are metabolically unhealthy, and it's not because of any individual's fault, it's just because our environments don't advocate for us to be healthy. So I'm trying to change that and flip it upside down.
Okay. Where are maybe some of like of those, where are some of those blue zones? Like where are these places where people are living over to 100 more than anywhere else?
Mm-hmm. Ikaria, Greece.
Okay.
So our keynote at our symposium last year was from Ikaria, George Karamalis. He also was on the Netflix documentary series, so you can watch.
I was going to say, I feel like I've seen something on, like I'm a big documentary guy, and I've seen something about the blue zones.
Yep. Mm-hmm.
Okay.
Yep. So Sardinia, Italy.
Yep.
Okinawa, Japan.
Okay.
There's only one in the United States, and it's in California, the Seventh-day Adventist community. And I think just recently, Singapore became the first modern city to become a blue zone.
Wow. Okay, and you're talking about how a lot of it stems from the environment, right? And I think, sometimes when you think of environment, you're thinking the sky, the water, and that's obviously somewhat of a factor, but that's not really what you're talking about, right?
No.
Okay, so talk to me more about what you're looking at in terms of like creating an optimal environment for people to live the longest.
Okay. So environment, I'm talking about human-built environment. Mm-hmm. So any man-made structures, infrastructures, systems that we've created. So how do we get to work? Usually in a single occupied vehicle where we're sitting.
Yeah.
What are we eating? Well, 70% of our food system is ultra-processed food, which causes the chronic disease that we have. The number one killer is from food-related chronic diseases. Lighting quality. We spend 90% of our time inside. A lot of the lighting is like not really proper for our circadian rhythm and our innate biology.
Yep.
So you can talk more about air and water quality too, but a lot of it is our food, our lack of movement. We're more socially isolated than we've ever been. So a big factor in the blue zones is they're part of community and connection. And just recently I got to experience Italy. I wasn't in Sardinia, but in this past spring I was there, and just their night culture of just how they all get together in the evenings. And we spend our evenings on the couch, watching TV.
Okay, so it sounds like almost like there's like elements or pillars to, identifying or creating an environment that lends itself to like the healthiest lifestyles that can lend itself to living these really long lives. There's so much I could tackle, knowing that we're in Buffalo, and there's a few different directions I want to go in, but like, where do you start? Is there like low-hanging fruit, meaning like, hey, let's start and chip away on this, knowing that like this battle is going to be longer. Like how do you even approach such a huge problem, such a systemic problem like that?
Mm-hmm. A lot of my work and what I've focused on, and I might be a little bit biased because I am a dietitian, but it's been with the food environment.
Sure.
And also the data shows, if you look at any of the evidence-based data, the number one cause of disease, death, and disability in our country is food, even before smoking, before genetics, before anything else in our life. That one behavior that we all do at least 3 times a day is responsible for most of our sickness. So I try to be as data-driven and objective as possible, so that's where I've started. And over my tenure at BNMC, over the past 10 years, I applied to a lot of grants to get seed capital, private and public funding. About $1 million I brought in to work towards building a healthier food environment.
That's awesome.
Mostly for East Side zip codes, because we know that that's where a lot of the health disparities are. There's a 13 to 20 year difference in life expectancy depending on what zip code you live in. And those zip codes also are immediately surrounding the medical campus. So, we try to be intentional and make sure that we're putting our funding and resources to prioritize those who need it most.
So basically, that's wild. So that's impactful. So in Buffalo, New York, the difference between living 15 years longer or 15 years less could be 1 mile, and just where you happen to live and where you happen to be born.
Yes.
Wow. And it makes sense. I mean, you've talked, I've done research on you, and you've talked, I use a term, I think, food apartheid versus food desert.
Yes.
What's the difference between a food apartheid and food desert in your eyes?
So a desert is a naturally occurring ecosystem. But what we're seeing in the urban communities in Buffalo, where there's no access to food, there's only one supermarket that essentially serves a bunch of people, there's nothing natural about that. So that's a result of decades of disinvestment from both the public and private sector in choosing to not service those communities, and has resulted in the severe health inequities and outcomes that we see today. So food desert is just too passive of a term, and it's better described as food apartheid.
How do you tackle that? I know I keep asking that question, but we're getting a little peeling the layers back, I guess, a little bit, because it's something that obviously needs to be addressed. How do you do that? Are you bringing farmers into the city, or I'm just curious, what your strategy is?
So one of the projects that I was a part of is called the Healthy Corner Store Initiative. And it's not something that I led. It's just a coalition of probably 20 plus nonprofits in the city of Buffalo that's funded by the Oshai Foundation. And we came together in about 2015 and pooled resources and figured out, what is a strategy? How can we get better food access into these communities? If we can't bring supermarkets in, we have to use another strategy. And a lot of the times corner stores are known for alcohol, tobacco, lottery. They're not usually seen as healthy places. But in working with certain store owners who really shared the vision of, I want to provide healthy food at my store. I just don't know how, or I don't know where to buy it. I'm not a big hospital. I don't get the economies of scale. I don't have that purchasing power. And so really it's just providing that training to the store owners and helping them accept, the Supplemental Nutrition Assistance Program, which is food stamps, teaching them how to work with local farms, bringing them on site, getting Cornell Cooperative Extension on board so they can do health screenings and nutrition education and tastings. We would put in different labeling throughout the store so that when a customer comes in, they know what the healthy items are and what to look for. We would do blood pressure screenings. And so this started 10, 11 years ago, and this is still happening now in the different corner stores. There's about, 12 to 15 corner stores in the East Side that are still going today. The only maybe disheartening or discouraging part of it is some of the federal policies that have been passed that have provided the infrastructure for this program to continue have been eliminated. And so unfortunately, as a community, we have to come together and figure out, okay, how can we do this? But thankfully, because we are in New York State, there's a lot more progressive laws that the governor has passed to help keep those programs in place. That's
awesome. So you start by, providing access, right? And it sounds like education as well. And so talk to me about food or nutrition education. I got to imagine this needs to start as young as possible, right? And kind of build that up, especially, in places like the East Side, right? How do you do that? How do you ensure that people are being educated so that when they walk into the corner store and they see the nutritious food, that they realize or educated enough to be like, I should get that, not something from the processed aisle over here? Like, how do you go about that?
That's a big, hairy question.
Yeah. Sorry. I'm sure you're like, yeah, no kidding. Like, yeah, these are really hard. That's what we're doing. It's fascinating to me. Yeah.
I mean, a lot of what I've focused on has also been in the education system for doctors as well. Even schools for kids. In my dietetic internship, I had to go to different high schools throughout the region. I was all over. I was in Clarence, Maryvale, Cheektowaga, Dunkirk, Silver Creek, providing these nutrition education curriculums. And the teachers were so thankful because they don't always have the knowledge themselves to teach about nutrition or don't have the time. And it really opened my eyes to how food illiterate our children are, even, at the age of like 13, 14. Some kids in our city haven't even had grapes before or certain fruits. So I don't even know. The education piece is just such a big one to tackle.
Yeah, it's huge. I mean, that we're not talking about education today because that's a whole nother subject, right? So something that I've seen pop up too in, reading about you is like the 2080 philosophy. Am I getting that right?
Yes.
Can you talk about that?
Yeah. Which really you want to focus on what you're doing consistently 80% of the time.
Okay.
So I talk about this with my clients a lot because it's a grasp a lot of people have trouble, a concept a lot of people have trouble grasping, right? So what does moderation look like? Like, can I just, if I want to have ice cream, like for breakfast every day, can I do that? Is that moderation? Well, I like to always have an objective layer. So how do we look at this objectively and calculate what does moderation look like? And the 80-20 gives you exactly that. So if you're eating 3 meals a day, 7 days a week, 3 times 7, that's 21 meals per week. About 80% of that is 16, 17 meals per week. So the difference between 21, 16, 17, okay, that's maybe 5 meals could be that where you might add an ice cream or have a fried food or a piece of pizza or something like that. That's 80-20. So that gives you a clear calculation of how many, keeping a mental note of when I can have these treats to stay consistent.
That's a good rule. So, okay, but we live in Western New York. Pizza, chicken wings, beef on whack. You name it, right? Food and unhealthy food is embedded in the culture of Buffalo and Western New York. That has to pose a significant challenge to this 80-20 rule.
Yeah, it does.
So how do we make it healthy knowing that it's embedded in the culture, to eat poorly?
You can still have moderation and do that.
I
mean, even in our 40 Days to Wellness program, I was really scared because of what you just said, because of how of a foodie culture we are, and coming in and telling people to saute with water, how are they going to receive that if they're used to sauteing with butter or maybe at minimum using a healthy oil? That's a huge shift. And I was really nervous about that, but it was very well received. People loved it. They come to our programs and they're still sauteing with oil. And so I think there's a lot of opportunity, but we also have to realize that we can't continue on the path that we're on as much. For our population size, the number of hospitals that we have is a lot more.
Yeah.
And there's a direct correlation between our chicken wing intake and our heart attacks and cancer rates.
Do you ever look into maybe something like the effect that the climate or the weather has on people's consumption? Especially, and their food habits, especially in the winter months. I guess I'm, of course, really talking about people who do have access to healthy food. Have you looked at that at all? I've done research on this, I swear, not even in preparation for this, just in surface level research. I'm curious if you've looked into that and what your thoughts are on that.
Yeah, it's really hard to be active too.
Yeah.
And being active has such an impact on our mental health. I mean, so many people in Buffalo are deficient in vitamin D. I see it all the time.
Yeah.
And I think that's a big part of why we get so sad and depressed in the wintertime. Obviously it's the lack of sunshine, but it's also being inactive, eating foods that probably aren't that great for us. And so I am starting to learn and think more about the power of social connection and how that can really get us up and out of our rut, or help encourage us to incorporate more healthy behaviors, because if you're trying to be healthier, well, you don't have to do it alone. Look at the Blue Zones. Like, they are constantly connected to their communities. They're involved in recreational sports. They're eating together at the table. They're doing all these different things. So I think in the wintertime, there's a lot more we can do to like rely on our community. Yeah,
I guess like the higher in latitude you go, the higher the prevalence of SAD or seasonal affective disorder, right? And I was like researching this one time as it pertained to like food and like buffalo food, and tell me if I'm wrong, but because I might be wrong, but especially in the winter months, it's so cloudy here, right? Because where we're located next to Lake Erie and Lake Ontario, and don't carbohydrates spike serotonin in your brain? Am I getting that right? And it's like I'll just say this in general. Maybe I'm wrong, but I just feel like when you eat something sugary or eat like a big pasta meal or something, like it's enjoyable. Like it's like something happens in your brain where you feel good about it. You might not feel so great about it 20 minutes later, but it seems like there's a higher prevalence of that like comfort eating between like November and I don't know, maybe not even February, maybe like April here. But I think to your point is if you can replace that with like human connection or whatever, hobbies or whatever it is that stimulates your brain in different ways, and maybe you can start chipping away at the bad habits that way.
Oh, yes. Yeah. So carbohydrates, refined carbohydrates, sugar, they light up our brain.
Yeah.
And that's what they were designed to do.
Yeah.
The food companies know exactly what they're doing. Fat, sugar, salt, that's supposed to overcome our natural satiety cues so that they're irresistible and you cannot stop eating them.
Yeah, it's tough. So out of curiosity, like there's another term that you talk about, and it's very, very interesting to me. It's food as medicine. Can you explain what you mean by that term? And then I want to kind of dig into it a little bit.
Food as medicine. It's a buzzword. It's been around for ages, for centuries. Ancient Greeks, Ayurveda, everybody's used it, but now it's really coming in. So what is it? In my own words, I describe food as information. Food is a signal that actually tells our cells at the cellular level how to respond and can turn genes on or off. And so that is the power of your plate. You can either activate disease or reverse disease, prevent disease actively with every single bite of food. And so it's become a very big movement in the healthcare space specifically. So food as medicine is an entire spectrum of different interventions that are delivered in healthcare settings to prevent, reverse disease, and treat disease.
Why do you think that there isn't more emphasis on healthy eating? Do you think it has to do with large pharma and where their interests lie?
Well, and that's how our healthcare system was designed.
Yep.
It was designed to put profit over people. It's not keeping people healthy. It's not doing its job because of pharmaceuticals and the incentives built into our system, medical device companies. And yeah, I just, that's why I work in public health, and I couldn't work in the system because it really caused me a lot of moral injury watching people fall through the cracks of the system. And I really felt helpless as a provider, like there's nothing I can do. So kind of working at the policy and systems level, you really can tackle it a lot better. And I'm hoping to kind of change that. Yeah. But of course, it's not without struggle.
Like it's very hard. When I hear food as medicine, I'm like, okay, medicine. Where do you get medicine? You get it in pharmacies, and we get it because we need it to deal with an ailment or to get better or whatever. And I'm like, food is medicine. Like, is it conceptually, like, could it be a situation if it was done right where, you know, you could go to your doctor and say, and maybe you're overweight or you're having blood pressure issues, and instead of just automatically, like, oh, well, what do they got? Okay, let me throw you on this medication. Hey, we need to adjust your eating habits or your exercise routine or whatever. But let's talk about food. Okay, here's a prescription, and you can go to these places, and all you can buy with it are, you know, nutritious foods that will help you with this ailment. does that exist anywhere? Is that like where this concept in your mind could go if it was executed properly?
That's exactly what we're looking to do. And
Okay.
it exists in many systems throughout the country right now.
Okay.
We're part of an entire field called lifestyle medicine.
Oh.
And it's where doctors are prescribing not only nutrition and food, but also fitness, social connection, stress management, sleep, avoiding risky substances. In Canada, they actually prescribe like nature therapy as a part of that. But that's exactly our vision and what we're building towards.
And in anywhere where you've seen this start to play out, is it, okay, so we talked about the food thing, but like when you just said like, and again, I'm just coming up with this on the fly, but you're like, okay, you need to be outdoors more. So I could give you a vitamin D supplement, but like you just need to be outdoors more. You need to be in the sun. It'll be good for you to be in nature. I just pretend like down the road is a national park and it's $20 to get into. Like, is this like, is there anywhere, or like, could this ever happen where it's like, hey, an insurance is going to pay for your entry fee to go 4 times a week, or like whether it's, or the insurance is going to pay, and I guess it does sometimes with HSA accounts and stuff, but going to pay for your gym membership. Like, where are we with that? I mean, because that seems like it would be huge and people would really utilize it because they'd really have no excuse. Like, you don't even have to pay for it.
Yep. Exactly. So the two most powerful pillars that we have are number 1, nutrition, and number 2, exercise. And we're already starting to build the database for how this prescription for food or movement relates to this outcome in your health. So for example, like if you have diabetes and you're trying to manage your blood sugar, your glucose, your cholesterol levels, your doctor is going to titrate your medications, and they know exactly this amount of medication will lead to this reduction in your numbers. But for lifestyle, we're still building the database for, you know, what is the prescription? Is it how many hours of physical activity, or how many fruits and veggies do you have to eat? And it's hard because it's so complex and interwoven with so many other variables and factors in our life. But we know that when we do implement these things, it lasts a lot longer than the medication. Like if you stop taking the medication, your disease comes right back. When you start implementing these healthy lifestyle behaviors, it lasts for months, if not years.
Yeah.
And when we've implemented this in Buffalo with our 40 Days to Wellness program, we found that people, you know, lost 50 to 60 pounds. They went to their doctor's checkup. The doctor's like, what have you been doing? You know, took them off their medications. And so you can absolutely put these diseases into remission. And that's what breaks my heart the most, that we have such a chronic disease epidemic, because these are preventable and you can put them into remission.
Yeah. You've mentioned 40 Days in the Wellness program a couple of times. Can you talk a little bit more about that? I'd love to, you know, kind of explain the program, you know, what you found, you know, that kind of thing.
Yeah, so we received a grant from Highmark Blue Fund program, and it was all about it was seed capital to start our food and lifestyle as medicine program. So this was geared towards 108 chronically sick and stressed individuals from Eastside zip codes in Buffalo. They received medically tailored meals. They received medical nutrition therapy from registered dietitians, mindfulness curriculum, nutrition education, cooking classes. And we specifically targeted individuals that had either pre-diabetes or diabetes and pre-hypertension or hypertension, which is high blood pressure. And about 19% of the individuals coming into the program were food insecure. And at the end of the program, I think about 9% of them were food insecure. We saw 97% improve their health, about 100% gained knowledge in healthy eating, 90% improved their mental health, 84% enhanced their cooking skills, and 78% sustained the mindfulness habits that they learned. And in addition to that, what made it so successful is that we purposely partnered with 5 minority and women-owned businesses throughout the city that were located in Eastside zip codes, so that, you know, it wasn't just me going up there. You know, you have to have those individuals that people look up to, that they trust, that they feel comfortable with, because otherwise it's not going to work. The cultural piece to what you mentioned earlier.
So you mentioned like multiple elements. So it sounds like in this program, you're teaching them how to cook healthy, how to understand nutrition, so they can make good decisions on their own. That's pretty cool. How do you, because I think, I got to imagine a lot of people really struggle with understanding, like, how do I eat healthy? like, when do I eat certain things? When shouldn't I eat certain things? How do I exercise with certain goals in mind? And it can be very confusing, especially with, there's a million different like diet programs and workout like workout routines. Like, it's crazy online, right? Like, so bringing it back, I mean, where do you start when you're educating people? Like, what are like the foundational principles that like people need to just like kind of wrap their heads around to start, leading a healthy lifestyle?
There's so much misinformation out there, and it drives me nuts.
Yeah, I'm sure.
But no matter where you're starting, the source of truth that I always come back to is eating more plants. Pharmaceuticals themselves are made from plants. So might as well just skip a step and just get more plants in your diet. Where are we starting? Are we starting at maybe 2 servings a day? Okay, what can we do to make it 3? If we're getting 0, what can we do to make it 1? There's a clear dose-response relationship between the more plants, fruits, vegetables, nuts, seeds, spices, beans, legumes that we eat, and the greater outcomes on our health. And that's mental health, physical health, cardiovascular health, sleep quality, the list goes on and on.
Yeah, it's true. And I feel like too, it's like anything, you got to form the habit, right? Whether it's starting to go to the gym, starting to run outside, starting to eat healthy. It's interesting, like, right, when you cut bad things out and you do it in like a safe way, like you like work your way up to it and then you build this habit, thinking about, like, if you eat really healthy for like, say, 2-3 months in a row, even thinking about having like that sugary drink or going to McDonald's, you're like, nah, like I don't even want that. But it's like you just kind of got into the rhythm. Like, if do you talk about that at all? Like, kind of like how to build that a healthy habit and like to ensure that like it's actually something sustainable. Because you know what I mean? Like, just more context. Like, you have people be like, okay, I've been eating terrible forever. I'm just gonna like cut out everything immediately, and then they're just like back on it like a week later because it was like too much at once. How do you approach like getting started?
Oh yeah, that doesn't work. That never works.
Yeah.
When we try to change too much at once, it's not sustainable, and you'll just a lot of the times end up gaining more weight when you go back.
Yeah.
So that's something I work on a lot with my clients in my one-on-one practice is small tangible goals, and whether we're meeting once a week or every 2 weeks or once a month, meet your first goal first and then work on to the next one, which is really hard for a lot of people because we're in this instantaneous culture. We like that instant gratification, and we want to do as many things at once. So, yeah, I mean, the tips that I use are, a lot of what comes from the book Atomic Habits, and just like habit
James
stacking. Clear. Yep. And just looking at the goal every day, putting it somewhere you could see it, reading it, reminding yourself of it. Maybe you need to tap into your social relationships if you're trying to cook more. Like one of the clients that I worked with, we could not get her to cook on her own, and she was relying on a lot of fast food, which was, as you can imagine, like inhibiting her from meeting her goals. Mm-hmm. And so what we ended up doing is just FaceTiming her friends every time she wanted to cook, and like doing that made it fun to the point where now she's cooking at home. Another client that I work with was having trouble managing their blood sugar. And so we were like, well, what do you like to do? What's something you enjoy? And we started a bike club, and now we go to bike club, and it's brought the blood sugar down and reducing the spikes after meals. So it's not always as just obvious as you think or painful. I have to be so disciplined. Like, there's ways that we can make it work for your lifestyle.
Yeah, I lived in New York City for a long time, and I used to make a lot of excuses about not cooking. Oh, it's hard to cook for... Yeah, you know what I'm talking about. You live there, too. It's hard to cook for one person.
That bodega egg sandwich is very, very close.
Yeah. It's hard to cook for one person. I have a small kitchen. I get invited out to eat all the time. Yeah, it can be hard. I think... I don't know. There's also like some social pressure there, too. Like, your buddies are like, hey, we're going to get wings. You're like, oh, I really shouldn't have these right now. But I think once you work through it a little bit, you realize most people don't really care. Right, and you just got to focus on yourself.
Mm-hmm.
Can I ask a question? Because I've never had a doctor ask me about my nutrition on any appointment.
Yeah, me either.
There. So it's like, it seems like that's outside of their job description. Actually, they're just trying to treat kind of what's wrong with you. So what is another angle that you use to kind of penetrate? Because that's where people get their health information, is the doctor or the internet. Yeah. Like, can AI help? Like, is that an option or?
Mm-hmm. Yeah, that's one of the things that we've been working on with UB's Jacobs School of Medicine, is educating our physicians. And we worked really hard to get the Gapel's nutrition course implemented in the school. So now all incoming medical students have to take this nutrition course and be aware of the nutrition strategies. I also teach food as medicine to the third year medical students every year in their intersession. And so we are actually presenting that program at a couple national conferences this year. So it's really cool to see like Buffalo as like a best practice on the national scale. There's been conferences that I've gone to that other people have presented at, and they'll show a slide of like UB is recognized for its food as medicine education program. And like that was something that I started, and I was like an attendee in the audience. So that was really cool. But in the age of AI too, it's something that as dietitians we have to learn how to work with, because it's just the reality. Everyone's going to ask AI or chat like, should I eat this? Should I not eat this? And you know, I'll see it all the time with my clients. They'll be like, well, I asked chat and it said I should do this. But chat doesn't know your clinical medical history and other things that are going on in your body. So actually, no, like that's not correct. And so it's just approaching that conversation with a certain amount of grace, and also like using motivational interviewing. And so it's sort of like asking the client permission, like, can we talk about this? And really making sure that they feel like the leader in their health journey, and I'm not there to like lecture them or tell them what to do. It really has to come from them, and they're setting the goals and what they're comfortable with, but also having a healthy source of like accountability for them.
So we've talked about blood sugar a little bit. We've talked about obviously nutrition, and I have to ask you, what's your opinion on GLP-1s?
GLP-1s, the hot topic. It's a and or.
Okay.
So some people GLP-1s have really helped them. And when you're using it the right way in combination with nutrition and exercise and strength training, it can do wonders for your health and help you get over that bump that you otherwise couldn't get over. They are starting to say now, the research is coming out, that once you're on a GLP-1, you really have to stay on it for life.
Yep.
Because once you get off of it, you gain the weight right back.
Mm-hmm.
So that's what I'm even starting to see in my own patients. But I think it is helpful to always try to do it without the GLP-1 first. But I do know for some people, it mentally is sort of like their emotional support, like knowing that they have that motivates them to do the work. And so I think it just really has to be individualized. But I think we kind of as a culture, we prescribe them a lot. Yeah.
I asked you because, you know, from my standpoint, from a legal standpoint, right, there's a products liability pharmaceutical case, right? And there's massive lawsuits against all the GLP-1 companies. And really it's not, the point is like, hey, we could walk into Home Depot and there's a million products that have warning labels on them and like, hey, warning, you can use this, but like, you got to watch out for X, Y, and Z. Don't use it this way. It could cause blah, 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 right? I think that's the problem, like from the legal community, at least on my side of things, that we have with GLP-1s is like that type of information that like, hey, it may work for you and very well may, but you have to be on it for the rest of your life. And if you stop it, it's all coming back. And it may come back worse than it was before, because if I'm not mistaken, I believe it targets muscle mass too. Like when you're losing weight the first time on it. And so then you're kind of stuck with visceral fat. And then when you come back, it's like almost impossible to build the muscle back. Mm-hmm. It's just like, you need to like tell people these things. And It seems like doctors are just like handing out prescriptions like candy right now, which is a little scary. It reminds me in a way of the opioid epidemic. Like it's different, but it's like the way in which it's being handed out in such a cavalier manner reminds me a lot of that. You don't need to comment on that if you don't want to. That's my opinion, but yeah.
The long-term consequences, I think, are being overlooked or downplayed. And like I think someone had mentioned, just like the role of the doctor is to kind of just do the best thing right now. But that might not always be addressing the root cause of the issue or be the best thing for that patient's overall health.
Yeah, and the doctors are trapped. Like the doctors, I get it, are trapped by, hey, we have to see a patient every 9 minutes so that we can bill insurance And that's the only way we can keep this practice running and keep these people employed. So, I mean, it's not uncommon to go into a doctor's office. I'm not even throwing shade at like the primary care physicians. It's like they have to move on. They can only have like these surface level like kind of conversations and then hopefully pass you along to somebody else. But like to Brett's comment, like it's extremely rare for them to be like, okay, you know, we need to talk about nutrition, or you need to go see a nutritionist or whatever, just because they probably like, hey, I'm not really programmed to do this.
Yes.
I'm not getting reimbursed for this. It stinks. It's like, it's a cycle, and it like kind of all comes back to insurance. But you know, again, that's my opinion. I hate insurance companies. Well, that's just me.
You're not the only one.
Yeah. All right. So I want to talk about the Food as Medicine Symposium. Is it the 6th year coming up?
It is.
Wow.
Yes.
Okay. So tell me all about it, because it sounds like you guys have had great success. So I want to hear about it.
Yeah, this is our 6th year. It's so exciting. So we get 250 to 300 people every year. It brings together clinicians, academics, industry partners, researchers, community health leaders, nonprofit executives, entrepreneurs, farmers, community health advocates, and all talking about how to better integrate our food system and our healthcare system. Mm-hmm. So we originally started during COVID in 2021, just on a Saturday on Zoom, because COVID really exposed the holes in both the healthcare and the food system.
Yeah.
And we had, 100 people engaged the whole day, and people were just really asking for more of this and wanted to keep going. And so from there, we built the Western New York Food as Medicine Coalition, which has 180 member organizations, and we've been going strong every year. So it's a 2-day event. We do a local food tour. We do a cooking demonstration. This year we're focused on gut health, inflammation, women's health, autoimmunity. We're bringing in a couple keynotes. One is Dr. Christy Arts, and she comes from Corewell Health in Michigan, and she is responsible for transforming that entire system into basically like a lifestyle medicine system. And so, like we were saying, like the healthcare system is built so that doctors only have 10, 15 minutes per patient. And so it's really hard to fit in talking about other pillars. But health systems across the country are doing this. Even the bigger ones like Kaiser Permanente, they've shown that they've been able to scale this. And so the whole goal of the event is to make Buffalo sort of a national leader in that. So I work really closely with Kaleida Health, Roswell Park, Catholic Health, and the VA on adopting some of these practices.
It's awesome. So you have people coming in from all over the place. And it's going to be in October this year?
October 15th and 16th.
Are you presenting?
Not this year.
No?
Sometimes I do.
Yeah. Sometimes it's good to like kind of just sit in the crowd and watch.
Yeah, and I learn a lot. And we offer continuing education credits for dietitians, for
awesome.
physicians, and there's really no conference like it, because if you're getting 10 to 12 continuing education credits, it's usually $1,200.
Yeah,
And this one is $200.
Yeah, it's awesome.
So
when you think about like maybe in a perfect world, like where would you hope Buffalo could go to from like a nutrition or health standpoint, maybe the next 20 years? And what do you think it takes to actually get there?
Mm-hmm. In a perfect world, people don't have to jump through hoops to be healthy.
Yeah.
In a perfect Buffalo, we can have our chicken wings and our cultural food in moderation, but it's not killing us. And the system is built in a way where we're getting a healthy diet. We're moving around throughout the day. We're using all the bike lanes in the city, and we're living to old age on minimal prescription medications. I've only been at this for 10 years, but it takes a long time when you're doing this kind of work. Sometimes it feels like you're moving against gravity in a way, and there's a lot of challenges. But when you finally have a win, it just fills my heart with so much joy, and to see it ripple across the community. Like, there's nothing more I could want for this city. And if we can do it here, then it shows that, like, if the home of the chicken wing can do this, then anyone can do it.
Yeah. Okay, so we mentioned bags earlier, like big, hairy, audacious goal. I mean, you have a daunting like task in front of you, right? Where does your will to keep pushing forward, where does that like, I'm going to get James Clear 1% better every day.
Yes.
Where does that come from? Like, have you always been like that? Like, talk to me about your mindset, like going into this, because every day you're fighting an uphill battle, but you don't seem to be losing energy. You seem to be gaining energy. Like, where does that come from?
Probably pouring into my own health, honestly. You have to lead by example, and you have to be healthy. And I'm very mindful of maintaining my own health, my own mental health, taking the time, setting boundaries, learning how to say no, which is really, really hard.
Yeah.
But you can't pour from an empty cup. So if I want to do my best work and serve, my community, I need to make sure that I'm full. And so that means taking a lot of PTO. That means doing things that maybe like traditional work culture would frown upon, but you have to make sure you're full in order to give to others.
Well, I'm curious now, like, what are things that you think people would frown upon that have helped you a lot?
I take a lot of PTO.
Well, you have it. You should use it, right?
Yeah. Saying no to things, not signing up for everything.
Let's start there. Like, how do you, just personally, like, what tactics do you, like, how are you able to say no to things? So that's very, very hard for people, whether it's saying no to going to have those beers with your friends, or saying no to that extra project at work that you can't handle. I don't know. How have you learned to do that in a way? It seems like you're comfortable with it, but sometimes it takes like doing it a little bit to get used to it.
Yeah. Just being transparent, it's always better to over communicate. And if I'm not really explaining, it's not that you have to over explain yourself, but just, this is my priority right now. And I know that if I say yes to this, it's going to take me away or dilute my effort over here, which I really need to focus on right now. And I thank you so much for offering this, but I really have to say no. I'm sorry to disappoint you. Let's connect like next time or something like that. And just, making decisions like that and understanding the consequences of when you do commit yourself to something, because I have overcommitted myself and seeing how it affects the outcomes. That's what motivates me to have stronger boundaries.
Is this how you're like managing stress too? Do you have any other methods of doing that?
Yoga.
Yeah.
Power yoga.
It's hard.
Yeah.
It's very hard.
Especially in the 90-degree humidity.
Yeah. Did you say that you do private consulting? Okay. So how can people find you if they want to work with you, like outside of your role at BNMC?
So I am a women's health dietitian for Flourish Nutrition. I focus on PCOS, endometriosis, fertility, pregnancy, postpartum, hypothalamic amenorrhea. And so you can find me at the Flourish Nutrition website. You can find me on LinkedIn, on my Instagram, Bites by Beth, and sign up. You basically just fill out your insurance information, and then we right away see how many visits you have, which surprisingly a lot of people have unlimited visits with a dietitian and don't know it. So it's just money you're already paying for. You might as well use it and meet with me.
You only work with women?
Mostly, yeah.
Damn it.
I'm just going to have to read more.
I'm going to make an alias, like fake online profile.
Janina.
Yeah.
Is there a main culprit in the food world that you would say, if anything, like just try and pay attention to this for your overall nutrition?
You mean like sugar versus carbs versus fat? Like, cause like there's like that raging debate. Yeah.
Is it sugar?
Yeah.
Like.
Oh yeah. Sugar. Definitely. And we don't get enough fiber. So what people don't know is that fruits and vegetables are protective. So you can eat processed meats, you can have your alcohol, you can eat your wings. If you're not getting the vegetables, those are going to hurt you like double. If you're getting the vegetables and eating healthy and like sprinkling in some of those things, it's really not going to affect you. So they've done a lot of research. It's been published in the Journal of the American Medical Association, and that like these foods are protective, and it's more harmful not getting them than getting them. So like that's the number one thing, is just getting that fiber from whole foods. And really everyone's into like the protein and the protein powder. Okay, that's great. But really, if you can get it from whole food, that's going to be the best because it's just packaged in a way that our body understands, can absorb it, and has all the nutrition.
So what you're not saying is go eat a bunch of vegetables and drink 15 beers and you're fine, right?
Oh, wait,
That's not what you're saying.
French fries are not vegetables, right?
Yeah, that doesn't count. I want to talk a little bit more about your one-on-one consulting because you mentioned, I think, working with women who are experiencing various health issues, but then you also talked about fertility. If a woman is like, hey, we're starting a family plan and is there like a plan that you put them on or a way you like kind of counsel them to say, hey, I know you're going to start trying, like this is what you should avoid, this is what you should do. Are you taking this into pregnancy? I'm kind of curious about that.
Oh, absolutely. Yeah. That's the majority of my patients are fertility. My niche is usually women who are between the ages of 30 and 45 and are trying to get pregnant and have tried themselves and can't. And it's like such a widespread issue right now. And, not everyone wants to do IVF. There's nothing wrong with IVF if that's what you want to do, but it's also expensive.
Extremely, yeah.
And so that's my niche is using lifestyle to enhance your natural fertility. And I have a fertility protocol that I work with ladies and put them on. A lot of my clients get pregnant after working with me, but there is a specific client that I'm really excited about right now. And she's 41 and she tried all the things. She went to an IVF clinic, did not want to do IVF, started working with me. And 6 months of following the protocol, she's pregnant and she's in her second trimester now. So it's just really rewarding. And then the realization also for me is that you're affecting not only mom, but also baby. Because when mom is metabolically healthy, that affects the baby's health for the rest of its life. So you're affecting two lives. And the supplement companies, they're just, they drive me nuts because they take advantage of this emotionally sensitive and delicate time. And there's a lot of supplements on the market that claim they're really good, but they're really not. And I would never recommend them. There's only really 3 supplements for fertility and that I recommend. So that's like a big piece of what I do as well.
Yeah, there's so much misinformation out there. It's tough. That's interesting, right? I think it should be obvious, but, you're eating for you and your baby. You're exercising for you and your baby. I think it's kind of scary, pharmaceutical usage, right? Like the amount of prescriptions that women are on that, look, they've been on it since they were a kid. I was reading a study recently on, women who from a very early age were prescribed Adderall, and the Adderall, the dosage goes up and up and up and up and up and up, and then they're trying to family plan, and the doctor is like, hey, it really would be better if you went off the Adderall. And she's like, yeah, but I've been on 40 milligrams or more for 15 years. I'm not even going to be able to operate. My brain's not going to work for a while. You must see that too. That's scary.
Yeah. Oh yeah. I have a client in Florida with this exact thing. So yeah, you just have to wean off very slowly, gradually over time, and which is hard if you're 40 years old and you don't really have time on your side to do that. But you have to just take everything into consideration. What's the risk versus the potential benefit? If going dead off is gonna, cause your body so much more stress, well, that's not good for supporting pregnancy either. So you have to kind of weigh what the path should be.
Yeah. For people listening who are okay, look, you've convinced me I need to, get healthier here. High level, not giving away any of your secrets, but high level, where do they start? Is it exercise? Is it nutrition? Is it both? What is the easiest way to kind of get into it and get going?
I would say, what is the low-hanging fruit? What do you like to do more? What do you enjoy more? Is it going to be easier for you to start tackling your nutrition? Tackle that. If it's going to be easier for you to start with moving more, you're an athlete or you really like moving and that's easy for you, do that. Start with one thing, work on it, set your goal. Once you hit your goal, then layer in the other pieces. And for the nutrition part, whole foods. eat whole foods. That's all I can ask. If you eat whole foods, quality matters a lot more than quantity. You don't have to track. You don't have to count calories. Just eating whole foods. You can eat as many fruits and vegetables as you want. I assure you, you will not gain weight. You will lose weight.
Okay, so I gotta ask now, what's your cheat meal?
My cheat meal?
Yeah, what's your
guilty?
We're
going there.
Yeah, what's your guilty pleasure, like bad buffalo food?
Okay,
bad
so
but good.
When I was in Italy, which has the best food ever,
Yep.
I just could not eat any more pasta. And I wanted a cheeseburger and fries and a shake. And when I got back home, that's what I ate. I just think that's so good. So yeah, I'll get like the Whopper, and I like fries and a shake.
Burger King gal. Okay, all right, I like it. I hadn't been to a Burger King in forever, and I was going to Detroit, and I was like, we should go here. And my wife's like, yeah. Like we went in there, I crushed a Whopper. I was like, this is great.
Yeah.
Excellent stuff.
Yeah.
Excellent stuff.
Okay, just a couple fun questions to kind of round things out. If you had like $50 million and you had to use it towards your mission of creating a healthier buffalo, what would you spend it on?
Ooh. 50 million. I would build a wellness center on the medical campus. And I would, change the local healthcare system, maybe even create my own insurance, like health plan. And I would be a health plan that would fund lifestyle interventions.
I love it. Is there anything that we haven't talked about that you think we should talk about?
I don't think so.
You sure?
Yeah.
Well, this has been awesome. I appreciate it. Brett, you got any questions?
No, I'm good. I got to come back on sugar.
I like putting you on the spot.
Oh my gosh.
Yeah, no, I do too. Like, it's for real. Like it's so bad because I have such a sweet tooth and we're like conditioned from a kid. You're like, well, I'll say this. I can't remember the article. I think it was a New York Times article that came out. You can search this article. It's New York Times, and it was an expose on the sugar industry. And it talks about how much money the sugar industry had poured into false advertising to get, like, say, I'm 42, like get my parents and like different generations of parents to believe that sugar was not the enemy, fat was.
Yes.
So hence us all getting hooked on, no shade at General Mills down the street, but like Lucky Charms and all the sugary cereals, and like our parents were like, well, this is fine. We need to be looking at the fat label. Like, have you seen this? Have you seen this?
Yeah, that's true.
That's crazy, right?
Yeah. They
Yeah.
covered up the research that blamed fat and or blamed sugar and blamed fat instead. And that's why they took all the fat out of our food system and loaded our bread and just things that aren't naturally sweet. They just put sugar in everything.
Yeah, it's crazy. There's a term called seeding the literature. And so I first learned about this in like many years of asbestos litigation, where you're pursuing justice for people who are diagnosed with mesothelioma caused by exposure to asbestos. You're pursuing the asbestos companies because you can prove fairly easily now, because of how many years we've been doing this, that they knew that it was that asbestos would kill people much later in life, but they didn't care because it was like, profits over people. But as you get further and further down in the litigation, what they do is, it's nuts. There's like, you got to follow the money, right? But there'll be massive amounts of money that are secretly given to dirty scientists who will open labs that look super legit, like really professional, great, fully staffed. And they'll be asked to say like, hey, measure the exposure to this asbestos product when it's worked in this manner, which is how people are claiming they were exposed and how they're getting sick. And they will purposely manipulate the study so that the data that comes out of the study shows that the product is safe. And my understanding is that essentially is what the sugar industry did for many years, is they would manipulate these studies so that the data that came out on the other end showed like it supported their theory and made their products that they're making all this money off of seem safe, which is super, super dirty. Never mind. I'm going to go down a rabbit hole, but like, that stuff like really bothers me. And it's like, and you're not just seeing it in like industrial settings. It's in the food industry as well. I mean, even now, like the mislabeling, it's crazy. Like you go in like the cereal aisle, like at like a grocery store, and there's like they try to make it seem like this is healthy and it has words on it
I
like
know.
protein and blah, blah, blah. Dude, turn that box around. It probably has more sugar than the one on the left that like is like I'm not going to name any names, but like the ones we grew up with that are like really bad for you. It's nuts. I mean, you got to see that all the time.
And the tobacco industry now owns
yeah.
most of the food supply. So they're using all of the tactics that they use to promote tobacco and sell to kids, market to kids.
Yeah.
They're now using that in our food system. So that's what we're up against.
Yeah, it's crazy. Anyways, we might have to have you back and talk about this more. But so again, you mentioned earlier, but where can people find you if they want to contact you or learn more about your private services or what you're doing, in your, we'll say your day job?
Yeah, at Buffalo Niagara Medical Campus, I love to collaborate. Email emachnica@bnmc.org, or you can just visit our website, bnmc.org. And if you're interested in learning more about fertility or your hormone health, you can follow me at Bites by Beth or bitesbybeth@gmail.com.
Thanks, Beth. Appreciate it. This is awesome.
Thanks for having me.
Thank you.